Finasteride and its side effects is a topic that, although has been discussed many times, I don't believe that it has a very, overarching detailed breakdown video on it, and, a simple guide, simple yet, comprehensive guide that viewers can watch and, figure out how to deal with their own side effects um, from finasteride. And basically today I just wanted to walk the viewers through everything that you can do to minimize your side effects from finasteride. I'm using, I'm using techniques that I've used with many clients, and going through it step by step. I haven't failed to minimize my clients' side effects that they had in the past experienced from finasteride. So I just wanted to share them with all my viewers, so you can too implement them and improve the quality of your life. Before we get into it, there are a couple things that need to be established. Number one, the enzyme aromatase converts testosterone into estradiol. Estradiol is the active form of estrogen. An aromatase is an enzyme which catalyzes the conversion. Everyone has different levels of aromatase. Aromatase highly depends on your body fat levels, and it's found in adipose tissues. Adipose tissues. So when you gain a lot of weight, you're gonna start producing more aromatase, and thus more of your testosterone will get converted into estradiol. The second thing that's important to know before we get into it is 5-alpha reductase converts testosterone into DHT, which is a potent form of testosterone, and it's the most potent hormone in the body, with a 5 times higher binding affinity for the androgen receptor than testosterone, and it's known to upregulate over 200 different genes after it binds to the androgen receptor. Point number 3, testosterone and DHT are both known as androgens. So in a lot of the discussions today, I'm going to be referring to androgens instead of specifically talking about testosterone and DHT, because they both are important for male sexual health. So they have different roles in the body. For example, DHT isn't found very much in the muscle cells, and it's something called a paracrine hormone. So it is produced in specific tissues, and it's not all produced in one place like testosterone. Point number 4, low or high levels of estradiol can cause decreased libido and ED. So later I'm going to talk about the side effects of low and high estradiol, and then also ways of minimizing side effects from estrogen. Point number 5, low androgen levels can also cause decreased libido and ED. And point number 6 is an abnormal testosterone to estradiol ratio can also cause a decrease in libido and ED. So it's not just the levels of testosterone and estradiol, but it's also the ratio between them. So someone can have high testosterone and low but normal estradiol, which are both two values that can, but they're both two values that aren't associated by themselves in and of itself to decrease libido, but when they're both present together, they can decrease libido. Okay, so there's 3 main causes of side effects on finasteride. Well, obviously, finasteride is the cause of the side effects, but the side effects are as a result of different processes that are a result of taking finasteride. So number 1 is changes in your estradiol levels. So depending on the amount of aromatase in your body, your estradiol levels can be altered in a way that will cause side effects. So if you're something that I'd like to refer to as a low aromatizer, your increase in testosterone will be far greater than an average person, and this will increase the ratio of testosterone to estrogen. And this ratio, as I've said before, is important for libido. So you're going to experience low estrogenic side effects. So say you already had bottom of the reference range estradiol, and then you take finasteride. Since you have such low aromatase levels, you're going to you're going to experience an increase in testosterone and then not much of an increase in estrogen. So your testosterone to estrogen ratio will increase beyond what is optimal for your libido, and then thus you're going to experience libido related side effects from finasteride. The second way estradiol levels are related to side effects is if you're a high aromatizer. So this is something I experienced personally when I started taking finasteride, because I was at a high body fat percentage, and then obviously because of that I had high aromatase levels. So I obviously took finasteride, then I got an increase in testosterone, and then because I had such high aromatase levels, lots of the testosterone that lots of the spike in testosterone that I got led to a conversion into estradiol. And since I already had a high estradiol after taking finasteride, my estradiol was above the reference range, so I experienced side effects related to high estrogen levels. So basically the two opposing sides is if you have below the low or below the range, or high or above the range estradiol levels, you're at risk of experiencing side effects from finasteride. An important note is that most people will have normal levels of aromatase and they won't experience side effects related to fluctuation in estradiol levels. Many people actually notice an increase in libido because of the increase in testosterone, and obviously testosterone is the main androgen in your body. Don't quote me on this, but I believe it's found 22 times. Its concentration in the body is 22 times greater than that of DHT. So it's the main male sex hormone. The second main cause of side effects is having low androgen levels prior to finasteride. So this is someone who is classified as hypogonadal or has levels that are near hypogonadal. You're almost certainly going to experience side effects on finasteride. This is because DHT is extremely potent in and of itself. It has a 5 times greater binding affinity for the androgen receptor than testosterone. And if you already have low androgen levels, and you begin converting one of your androgens into a less potent form, you may not have the same androgenic level that's needed to maintain libido and also erections, because DHT is it's known to influence nitric oxide production, which is like important for vascularity. So yeah, if you have low androgen levels before finasteride, there are a couple of things you need to consider. You need to consider raising your natural testosterone levels. This can be done through diet, exercise, lowering your body weight, as I mentioned before, because that will decrease aromatase levels and then increase testosterone levels as a result. And then this will mean that even though you're losing that DHT, you have enough testosterone to fulfill that androgenic burden. Also sleep. very important for testosterone levels. A lack of REM sleep will, uh, REM sleep is important for maintaining hormonal levels. So, and then if all of these things don't, within 6 months don't help natural androgen levels, then you need to look into alternative treatments like HCG, aromatase inhibitors, TRT, recombinant FSH, and then also, if none of these work, you might have to consider synthetic androgens such as proviron, and also maybe looking at neurosteroid link. Speaking of, that leads perfectly into the third reason you're experiencing finasteride side effects, but it's not actually from finasteride. It's from if you're taking dutasteride. I just thought I'd condense it into the one video just so it's comprehensive. Dutasteride is an inhibitor of all three isoenzymes of 5-alpha reductase, whereas finasteride is almost solely a selective inhibitor of the type 2 isoenzyme of 5-alpha reductase. And unfortunately for dutasteride users, the type 1 5-alpha reductase isoenzyme is involved in the production of the neurosteroid allopregnanolone, and a alteration of neurosteroid levels such that the precursors to allopregnanolone are increased and allopregnanolone levels are decreased it might result in symptoms of depression and anxiety, because allopregnanolone is known to bind to the GABA receptors in your brain, and it's involved in stress and mood regulation. This is obviously dependent on if dutasteride readily crosses your blood-brain barrier, and if you're not already experiencing depressive-like symptoms or anxiety symptoms, then it may be the case that you aren't experiencing altered levels of neurosteroids from dutasteride. But if you are, you're going to have to switch back to finasteride, which I know a lot of people won't want to do, because finasteride will block about 70% of DHT, whereas dutasteride will block about 90% at the recommended doses, even though dutasteride doesn't have a recommended dose for male hair loss, because it's only prescribed off-label. But I think most people take it about 1.25, and then for finasteride it's obviously prescribed at 1 milligram. So yeah, you're gonna want to. Sorry, I got a bit sidetracked there, but if you are experiencing decreased levels of neurosteroids from dutasteride, you have to consider switching back to finasteride, and then you can look into alternative strategies to deal with the residual 30% of DHT, such as topical saw palmetto. I know that I'm gonna cop a lot of shit for that, but saw palmetto is it's been shown in a study two studies actually, to reduce DHT binding affinity to the androgen receptor. So even though you're not blocking the production of the last 30% of DHT, you're reducing its ability to bind to the androgen receptor, and thus transcribe the effects that will lead to the miniaturization of your hair follicles. So finasteride plus topical saw palmetto will create will cover your hair loss enough, similar to that of dutasteride, without actually affecting neurosteroid levels. If those two don't work together, you might have to consider adding in RU58841. I'm going to discuss this more later, but yeah. So yeah, those are the three ways of how finasteride will cause side effects. So let's get into managing estradiol levels and deep dive in how you can do this to decrease finasteride side effects. Okay, so firstly you have to establish if you're a low, high, or normal aromatizer. So firstly, get blood work before you get on finasteride, but if you don't already, just check what your estradiol levels are on finasteride. If they're approaching the low point of the reference range, that means your testosterone to estrogen ratio is probably too high, or if most people will experience high estradiol levels after finasteride, because I think I saw a stat like 70% of American men are overweight or obese, so that most men watching this will probably have estradiol levels that are too high for optimal libido. So this is more the managing estrogen levels is more suited to those who have high estradiol levels, but it's possible that it's also due to low estradiol levels after the conversion of testosterone to estradiol via the aromatase enzyme. So if it's the case that your estradiol levels are below the reference range, there are a couple of things you consider doing: increasing your body fat percentage. If you're taking any aromatase enzymes or any over-the-counter supplements that I'll talk about, you need to stop doing that. And then some other strategies I'll discuss soon. But before I talk about how to manage estradiol levels, I want to talk about what the side effects of high or low estrogen are. Side effects of high estrogen can be acne, water retention, gynecomastia, low libidos, erectile dysfunction, and moodiness. Side effects of low estrogen can be dry joints, feeling of dehydration, dry skin or lips, low libido and erectile dysfunction. So as you can see, estradiol levels are important to manage because there are side effects that appear in like a U-shaped curve. So too much or too little will cause similar side effects, particularly erectile dysfunction and low libido, which are the topic of discussion for finasteride side effects. So it's important to keep in mind that it's hard to know which side of the curve you're on if you have low or high estradiol levels without taking blood work, and just by guessing isn't really an accurate way. So yeah, get blood work first. Also, before I dive into the methods of management, there's also important understanding about estrogen. Estrogen, I'll refer to it mostly as estradiol or E2, which is the active form of estrogen, but there's also E1 and E3. E1 is estrone and E3 is estriol, which are less active forms, but estradiol is the primary point of concern for managing estrogenic side effects. So how can we manage estradiol levels? The first thing to consider is addressing the low-hanging fruit. Number one, reducing your body fat percentage. So aromatase enzyme expression is much higher in adipose tissue. So reducing adipose tissue or body fat will lower your aromatase and estradiol levels. For men, the sweet spot for this appears to be between 8 to 12%. Between this range, you're going to have the most optimal hormone levels. Another low-hanging fruit is insulin resistance, which is somewhat related to your body fat percentage, but having chronically elevated insulin levels will lead to the overexpression of aromatase. And just general poor dietary choices will lead to high aromatase levels. So address all these things and you will lower your estradiol levels, and thus you won't have to look into over-the-counter supplements or prescription medications, which obviously come with their own unique side effects. So going further than this, you want to have addressed these low-hanging fruits first, but if they don't work for you, or for whatever reason you don't want to do them, you can consider over-the-counter supplements or aromatase inhibitors, which are a prescription medication, and thus using them recreationally is illegal. But they are scientifically proven to lower estradiol, so it's important that I mention them. So firstly, over-the-counter supplements are most suitable for those who want to lower aromatase naturally, but have already addressed the low-hanging fruits like reducing body fat and insulin resistance. But it'd be prudent not to mention that they won't lower estradiol levels as significantly as aromatase inhibitors. But if you already have naturally, if your aromatase levels aren't quite as high, you don't really need inhibitors. So it's more suitable for these type of people. The first over-the-counter supplement is dianyl methane, or DIM. With my clients, I tend to have them take 100 milligrams in the morning and 100 in the evening. This will help them balance their estrone and estradiol levels, because DIM will metabolize estradiol into E1, which is the less active form of estrogen, and this will help my clients experience less estrogenic side effects from the elevated E2 levels. Another over-the-counter supplement is vitamin C. I'll have my clients take 2,000 to 5,000 milligrams daily, and that may inhibit aromatase enzymes because it has antioxidant effects, and it's also beneficial for collagen deposition. So as I mentioned before, insulin resistance is a contributing factor to increased aromatase expression. So you want to consider some over-the-counter supplements that improve insulin sensitivity, and as a result will lower estradiol levels. Some of these supplements that will improve insulin sensitivity is berberine, cinnamon extract, alpha lipoic acid, and fenugreek. In my opinion, berberine will show the most efficacy, and it's been used for a long time by bodybuilders to improve insulin sensitivity, and then obviously decreasing insulin resistance in the muscle is, very beneficial for bodybuilding. So it's important to mention that, by the way, all these supplements that I mentioned, I'm pretty sure they have no direct evidence, like studies that directly look at their effects on estrogen levels, but there is indirect evidence because of, insulin resistance being a contributing factor for aromatase overexpression. Nicotine gum is also a mild aromatase inhibitor. Also, by the way, if you're interested in nicotine and its cognitive enhancing effects, I have a video about this. Another one is tadalafil. I believe tadalafil is a research chemical currently, so it can be used on your lab rat at 5 milligrams daily to reduce estradiol levels and improve the ratio between total testosterone and estradiol. However, I don't want to encourage the recreational use of research chemicals. I'm just trying to be as comprehensive as possible. Another thing is metformin. I theorized in one of my blog posts that the reason metformin lowers estradiol is because it blocks tumor necrosis factor alpha, which indirectly lowers estrogen levels, because tumor necrosis factor alpha has been shown in a study to increase aromatase gene expression in adipose tissue. So using metformin, particularly if you're overweight, will be certainly effective for lowering estradiol, but obviously metformin will come with its own side effects. So not necessarily recommending it. Also, melatonin, zinc, and calcium D-glucarate will also lower estradiol levels. Okay, now let's get into the particularly potent but still effective aromatase inhibitors. These are prescription medications, and I believe they're illegal for recreational use. But these three are the ones used by bodybuilders recreationally. And I think they're different generations of aromatase inhibitors, and these are the most, less. The other ones are more primitive. These are less side effect burden, but obviously they are not free of side effects. So number one is aromasin or exemestane. It's something called a steroidal suicide inhibitor. Number two is arimidex or anastrozole, which is a non-steroidal reversibly binding inhibitor. And there's also letrozole or Femara, which is a non-steroidal reversibly binding inhibitor. All right, let's look at the properties of these aromatase inhibitors. Aromasin or exemestane is an oral suicidal aromatase inhibitor. It's important to mention for aromasin that it has a steroidal structure, and which will lead to an increase in the ratio of free to total testosterone by lowering SHBG. And because of its steroidal structure, it will also be better for your lipid profiles. By the way, also, a suicidal aromatase inhibitor means it binds to aromatase enzymes and permanently disables them, which will prevent an estrogen rebound seen by arimidex and letrozole. Aromasin has a short half-life at around 9 hours, but will suppress estrogen for up to 72 hours for a 25 milligram dose. Next, we have arimidex or anastrozole, which is a non-steroidal reversibly binding inhibitor. In some studies, 1 milligram of arimidex lowered estradiol by 70% within 24 hours and then 80% after 2 weeks of administration, suggesting similar pharmacodynamics to that of finasteride, because it had, like a buildup of concentration. Obviously, it had a different effect to finasteride, but because it's a reversibly binding inhibitor of aromatase, not 5-alpha reductase. However, like their pharmacodynamics are similar. It also showed that 0.5 milligrams had comparable effects. Lastly, we have letrozole, which appears to be the most nuclear option from everything I've seen in studies and also being on these bodybuilding forums. It will highly potently crash your estrogen, and you're going to experience likely going to experience low estrogenic side effects. So if you want to prevent estrogenic rebound from arimidex or letrozole, you really need to taper off the dosage. And also remember, lowest effective dosage is best for your health. Don't just follow arbitrary numbers given to you by some random bloke on a forum. So yeah, blood work. Get it during, before, after using any of these. I don't encourage the use, but they do exist and they have been used for decades by people on Finasteride and also people in bodybuilding forums. So yeah, aromatase inhibitors, I think that's as comprehensive as I can get. Another important thing, one of the last things I want to mention when it comes to managing estrogenic side effects is prolactin. So prolactin has been shown to increase estrogen receptor sensitivity, So this will make people more sensitive to estrogenic side effects. So for example, someone could have normal reference range estradiol, but if they have elevated prolactin, they're going to experience estrogenic side effects such as reduced libido and erectile quality. So you want to ensure your prolactin is in the reference range. I've seen, well, it's certain in the scientific literature that marijuana will significantly increase prolactin. So I've noticed that my clients that are recreational users of marijuana, they also experience side effects from finasteride, even though their estrogen is within the reference range. And they also, like I said, they have elevated prolactin. Also alcohol and kratom. So these three recreational drugs are very well known to increase prolactin levels. And then that obviously in turn will increase your risk of estrogenic side effects. So it's important you stop the recreational use of these three drugs if you're experiencing side effects on finasteride. However, if you just have naturally high prolactin levels, which is, by the way, very, very uncommon amongst men, there are a number of things you can do. You can take zinc, ashwagandha, ginkgo biloba, maca powder, and ginseng extract. Did I mention ashwagandha? If I didn't, ashwagandha as well. I think that is basically as comprehensive as I can get in regards to managing estradiol levels in order to reduce finasteride side effects. This seems to be the greatest contributor of finasteride side effects. I've seen this amongst my own clients. Like typically, people who are experiencing side effects, it will typically be due to their estradiol levels. Next I want to talk about low androgen levels and how having low androgen levels before taking finasteride will cause side effects. First, I'm just going to grab a drink of water. Alright, anyways, let's continue talking about ways of minimizing side effects if you have low androgen levels prior to starting finasteride. So, having low androgen levels means either, when I say that, I mean you have low or below reference range levels of testosterone prior to starting finasteride. And the reason why this will cause side effects is because DHT is obviously a more potent version of testosterone, and having androgenic, so there's a certain androgenic burden that testosterone won't be able to fill unless it's in a high enough range that DHT provides. So if you already have low testosterone levels, converting your DHT into test will potentially won't provide you with the same androgenic burden that you'd have before, and that's needed to maintain erections and libido. So, the way I can say this is, imagine you have 100 molecules of testosterone in your body and 10 molecules of DHT, right? This is obviously far from the case, but it's just as simple as I can put it, because I don't think I'm explaining this very well. Each molecule of DHT is worth, 5 molecules of testosterone in terms of androgenic burden. And say you need 120, like you need 120 worth of androgenic properties. So with 10 molecules of DHT and 100 of testosterone, you're going to have 150 androgenic molecules, right? If you convert those 10 DHT molecules into 10 testosterone molecules, you only have 110, whereas before you'd have 150, and you're not fulfilling the requirement to have 120. Obviously, this is not an exact science. I'm just trying to put it as simply as possible. But if your testosterone levels are too low, it won't be able to fulfill the androgenic activity needed for libido and erections if you start finasteride. So the question is, how can we increase androgen levels so we can fulfill the androgenic burdens that we don't have with DHT now being in the body? So firstly, lowering body weight will lower aromatase levels, increase testosterone levels, and thus decrease a lack of side effects that come from a lack of androgenicity. Other things that will increase testosterone levels are regular exercise and better sleep, and also your diet. One of the biggest things is tracking all your micronutrients using a website like Chronometer. Just fill in whatever you're eating during the day, and then see what micronutrients you're deficient in, because for the production of hormones you need to have sufficient micronutrients. So use a website like Chronometer. Just track your calories in general. Track your food in general, to see, even just the basics like macronutrients. You'll need a specific amount. People who do keto or carnivore will typically have suboptimal testosterone levels. So just research into the kind of diet that is optimal for hormone levels and try to stick to that. The other ways of managing low androgen levels are, they're pretty extreme, but they also need to be mentioned. So address the low-hanging fruit first, and then you can consider, with your doctor's supervision, other treatments. These include HCG, which is human chronic gonadotropin, TRT, recombinant FSH, which is more expensive than HCG, or synthetic androgen such as Proviron. Alright, let's start with HCG. HCG can be used to boost your testicular function without, taking TRT exogenously. It's also important to, I'm not going to recommend it or anything like that, but if you use HCG before TRT, you'll see how your body responds to the HCG, and then whether a post-cycle therapy is even viable for you. If not, you might have to consider doing TRT for life to increase androgen levels. About 90% of guys won't need this unless they're, over the age of 45 or what have you. But yeah, HCG before TRT is definitely optimal. Also, another thing about, let's move on to TRT. A thing about TRT that a lot of people actually don't consider is that testosterone naturally produced in the testes is more readily converted into DHT, because there's obviously that 5-alpha reductase presence in the testes and surrounding the testes. So if you're injecting testosterone, you're going to have less conversion into DHT than what would otherwise happen naturally. Also, if you're using something like a testosterone cream and you're applying it to your to your scrotum, you're gonna have a lot of it convert to DHT. So it's also the method of administration of TRT actually matters a lot too. So yeah, TRT will obviously increase your androgen levels and decrease side effects from finasteride. Also, recombinant FSH will increase androgen levels. It will act in a similar way to HCG, and stimulate the testes to produce more testosterone. But I believe recombinant FSH is much more expensive than HCG. Also, neither are approved for increasing androgen levels. I believe, I'm not sure if HCG is a research chemical or a banned substance. I think it might depend on the country. Also, Proviron is a synthetic androgen. It's very, very androgenic. I would not recommend it because it will certainly cause hair loss, which is what you'd be trying to avoid while on finasteride. However, it will definitely increase libido by a lot. So it's just something to consider. Other strategies are probably far too extreme, and I'm not going to really mention them. So those are the couple of things that you want to stick with in terms of treating low androgen levels and sexual side effects that come with that if you use finasteride. The last thing I want to talk about is the neurosteroid link. This is related to dutasteride because dutasteride is inhibitor of all three isoenzymes of 5-alpha reductase, whereas finasteride is almost selective for the type 2, and the type 1 is involved in the production of neurosteroids such as allopregnanolone, which, as I mentioned earlier, is involved in mood regulation and stress response because it's known to bind to the GABA receptors in your brain. So if dutasteride will readily crosses your blood-brain barrier, you're going to experience alterations of neurosteroid and neurosteroid precursor levels, and you may experience depression or anxiety, all symptoms of the two. So, okay, let's talk about how we can minimize these neurosteroid alterations on dutasteride. Firstly, finasteride will not affect neurosteroid levels. I made a video about this if you want to check it out. Whereas dutasteride certainly will. So the first thing you want to do is consider stopping dutasteride and use finasteride instead, which I know a lot of you are worried about because finasteride will only inhibit about 70% of your DHT, whereas dutasteride will inhibit about 90%. So if you're worried about the continuation of hair loss because you have less DHT suppression on finasteride instead of dutasteride, you can use finasteride with topical saw palmetto because it will reduce DHT binding affinity to the androgen receptor, effectively dealing with the remaining 30% of DHT in your scalp. And also applying it topically will reduce systemic activity of saw palmetto, and thus it will be the 30% in your scalp which have a decreased binding affinity to androgen receptors. If this saw palmetto doesn't provide you enough coverage, you might want to consider adding RU58841. The reason being, obviously, there's the remaining 30%, and if the saw palmetto isn't working for you, the RU58841 might outcompete the DHT for the androgen receptors, binding to them and essentially blocking DHT from binding to them and then thus causing hair loss. And RU58841 won't affect neurosteroid levels, and neither will finasteride, so this will be safe on neurosteroid levels and thus help manage side effects. If you're worried about side effects from RU58841, consider drinking grapefruit juice every second night before applying RU58841. I have a video and blog article explaining how that will reduce the potential for side effects on RU58841, but essentially the reason is it will block the conversion of RU58841 into its problematic metabolite and thus increase its conversion into a different metabolite which isn't a potent anti-androgen. The last thing is if you still are experiencing hair loss and you want to switch back to Dutasteride and it's been working for you, you can consider snorting progesterone. Intranasal administration of progesterone will protect your brain from poor neurosteroid production. But there are two concerns. Number one, it has a addictive effect because it will lead to an acute dopaminergic response through the intranasal delivery of progesterone. The second concern is that of withdrawal from enhanced expression of GABA receptor A4 subunit, but if the progesterone dosage is low enough, you won't experience a withdrawal effect or a supratherapeutic level of progesterone. Also, reduced libido is linked to the oxytocin dopamine system, which is impacted by reduced androgen signaling, which can happen if you're taking finasteride and you have reduced DHT levels. So some dopamine increasing medications may improve sex drive. Also oxytocin, looking at the oxytocin pathway might also increase sex drive, but I'm not going to get too deep into that because it's quite obscure. Another consideration is hypoandrogenism is thought to cause fibrosis within a certain part of penile tissue through collagen fiber deposition and the inhibition of nitric oxide synthesis, because basically, by the way, hypo and hyper are opposites. So hypoandrogenism is when you have a lack of androgenetic activity, and there's been a study that 5-alpha reductase inhibition will cause localized hypoandrogenism within the penis of rats, and that will lead to apoptosis of certain cells within the penis of rats. So it's been speculated that hypoandrogenism locally could lead to fibrosis and apoptosis. By the way, apoptosis means like cell death within the penile tissue, and this has yet to be shown in human studies, and in my opinion, it's likely not to be a problem. But if, for example, you're experiencing a lack of girth or something, you might be experiencing this localized hypoandrogenism, and you might want to consider a PDE5 inhibitor like tadalafil or Viagra, and this will help prevent this from occurring. Okay, I think that's basically everything that there is to discuss. I hope you enjoyed, and I hope this helps.